Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Dr. Jonathan Cahill. He is a neurologist at Rhode Island Hospital. We are here to continue our discussion on multiple sclerosis, MS. It is Dr. Cahill's first time on the show, so first of all, welcome to the show.
Thank you very much.
We have been talking a lot about MS on a few shows that we've had here recently. Maybe they missed the other shows, sort of a general definition of what MS, what multiple sclerosis is. And thank you for being on the show, by the way.
Sure, happy to be here. Thank you very much for having me. MS really is a neurological disease that affects the brain and the spinal cord, and it often affects young people primarily, or at least at the beginning. It's diagnosed most commonly when people are in their 20s, 30s, and 40s. And when you think about MS and how it affects people, it can affect people in any way that the brain affects people. The most common symptoms of MS that people have are changes in their vision, loss of vision in one eye, numbness, loss of sensation, or weakness.
Funny, some of those things you described could be from diabetes or, there's a lot of symptoms that are similar with certain diseases.
Absolutely. Depending on what part of the nervous system is affected, whether it's a nerve in your foot or a nerve in the brain or spine, it can indicate different disease processes or different diseases. And so MS is really a disorder of the brain and the spine only. It does not affect the nerves out in the arms and legs, for example. And you can really tell that, I can tell that as a neurologist when I examine people and when we look at MRI scans and things like that. As to what exactly MS is, apart from saying that it's a disease of the brain and spine, we think the root cause of it is that the immune system, which is the part of the body made up of white blood cells that fights off infection normally, kind of becomes overactive. And it's an autoimmune disease where your immune system attacks your own brain and spine or in a person with MS. So over time, what that causes is episodes of symptoms. People call them attacks or relapses of MS, where people have new symptoms develop over time that then fade away. For example, somebody might lose vision in their left eye for a few weeks, and then the vision gets better. That's called optic neuritis, and it can often be the first sign that someone has multiple sclerosis. They call it multiple sclerosis because the brain and spine develop scars or scleroses over time. And usually when that happens, people have attacks of symptoms. So MS has been around for a long time, hundreds and hundreds of years, and it used to be, before the days of MRI scanning, that people would make the diagnosis of MS based on a number of symptoms happening over time. So somebody had loss of vision in one eye, and then a year later they had numbness from the waist down. Well, that was called multiple sclerosis. And over time what we've learned, mostly by using MRI scans, is that that shows up as white spots, for example, on these MRI images. MRI is a very advanced technique and tool for taking pictures of the nervous system. And so we understand MS to be an overactive immune system or an autoimmune disease. We don't know what the cause of it is. There are lots of theories as to it might be triggered by an infection. So your body, you get an infection from a virus perhaps, and your immune system, which gets revved up to fight that infection, kind of gets overactive in an abnormal way. There's lots of autoimmune diseases.
How about genetics?
Yeah, there's definitely a genetic role, although it's not entirely genetic. If you had identical twins who have the exact same genes, only about 30% of the time when one of them has MS, will the other one have MS. So it's not definitively genetic, but 30% is a much higher risk than an average person.
Yeah.
The average risk of MS is certainly less than 1% in the general population. So there might be a genetic predisposition. MS is more common among people whose ethnic or racial background is white Northern European. So it's more common in people in those genetic groups. It's less common in some genetic groups as well. But all genetic groups can get it. It affects everybody. It affects men and women both, although women get it much more commonly, probably 2 times as much or maybe even 3 times as much as common as men.
Have they figured out that a reason why gender might play a role in one gender getting it more?
Not really, except that the immune system in men versus the immune system in women is probably different. Almost all autoimmune diseases are more common in women. We don't know why that is, but things like lupus and rheumatoid arthritis are all more common in women than in men. So MS goes along with those other autoimmune diseases in that way. And because we think it's an autoimmune disease, the treatments for MS, which have really only become very, very advanced in the last 20 years or so, are all targeted towards the immune system.
Well, that's the key, isn't it? Whenever there's a successful treatment of any disease, what you're not really attacking the disease itself. You're enabling your immune system to do its job, right? Is that basically it?
I think that's a good way of putting it, because all these drugs that are on the market alter the way the immune system functions, and the hope is that they promote normal immune system function.
Except for like cancer, where you're directly targeting a tumor, maybe, or something.
Yeah, and you can't, for example, in cancer, all the tumor cells are bad.
Right.
Right. You can, as much as possible, take the tumor out with surgery, try to kill the tumor cells with chemotherapy. In MS, if you did that, you'd be left without an immune system, which of course has its own problems.
Right.
You'd be very prone to infection and other things.
Can't treat one disease the same way you treat another, at least in those two examples.
Exactly,
Yeah.
exactly. An autoimmune disease is, I think, fairly tricky to treat and find the right balance between normal immune system function and overactive immune system function, and try to avoid underactive immune system
When it's
function.
overactive, does it still attack the disease? That it's, I mean, it seems like it would go after everything, but I mean, it's still not a good
Yeah,
thing.
no. When you have an autoimmune disease, that's the disease itself is the overactive white blood
Yeah.
cells. So, rheumatoid arthritis is a good example. It's a type of autoimmune disease where these white blood cells, the immune system, attack joints and other things, but joints, and that's why people get inflammation in the joints and elsewhere. In multiple sclerosis, you have white blood cells attacking the brain and spine. And so if you looked at the brain or spine of a person with multiple sclerosis under a microscope, you'd see a lot of inflammation. You'd see a lot of white blood cells. And all these treatments either change the way white blood cells function or reduce reduce the total number of white blood cells. Since 1993, there have been the development and FDA approval in the United States of many drugs. There are now 12 or 13 on the market, FDA-approved drugs for the treatment of multiple sclerosis, and they all work in that way. What they are shown to do, what they're proven to do, is reduce the number of attacks that a person with MS gets. So MS, over the years, it starts off with attacks. People get an attack of vision loss or an attack of numbness on one side.
You know, the one thing about that is if it's an intermittent thing and it goes away after a while, that probably is a problem because people think that there isn't a problem and won't go and get diagnosed, right?
Absolutely.
And they think, it went away, I'm fine now.
Absolutely. The delay to diagnosis is a problem, although many of the attacks are quite severe and you can't ignore it. But people do have attacks that they might ignore. Say it's something like tingling on the face that lasts for a few days. People might not think that that's the first sign of MS. And so when we see people who have the first attacks, one of the questions for them is always, have you ever had anything like this before in the past? Have you ever had a symptom that lasted for a few days that you kind of ignored? And it may or may not be MS.
Right.
You know,
But they think back and they go,
but they think back and they say, yeah, no, that was weird because my legs were tingly last year for a few days. I didn't think much of it. I thought maybe I had, twisted my back wrong or pinched a nerve or something like that would be a common thing that people say. And for us, it's important to identify people as soon as possible because what we know is that in people with definite MS, the sooner they're treated and the sooner the immune system can be kind of turned down a little bit, the better they do in the long term.
Because will it get worse if you go untreated?
Unfortunately, even with treatment, most people get worse. That's the problem, is that the treatments are not perfect. None of them cures MS. It reduces the number of attacks people have, and we think in the long term, if you're maintained and the drug is working properly, it will reduce the eventual disability from MS.
So you can kind of live a little bit more of a normal life for however long if you get treatment as soon as possible.
Yes, definitely treatment as soon as possible, I think, is very important for people with MS, and long-term treatment for now, because we don't know what's going to cure this disease. Obviously, there's a lot of interest and research on that subject, but we haven't gotten there yet. We're not.
Well, let's talk about some of that research. Your field of expertise, you're a neurologist. I know one of the things that we can touch on is stem cell research, which stem cells in general, that is like a hot, that's a hot word right now, hot expression right now. And people may not understand, first of all, what are stem cells and how can they help?
Okay. Stem cells are a type of cell in the body that essentially can become any type of cell. So all of our cells initially started as stem cells, whether they became a bone cell or a hair cell or a brain cell. In the end, we don't know. One of the features of MS that you can see in the brains and spines of people with MS is that the immune system attacks, especially at the beginning, the insulation on nerves. It's called myelin, and so the inflammation episodes that people have, the attacks, cause their nerve cells to lose the insulated covering, and it makes nerves fire less efficiently, and so that's why people have symptoms, because their nerve cells, their neurons, are not functioning well. If you could create a stem cell that would become a myelin cell and re-put that insulation on a nerve, obviously that would be great, because people would regain their function and the effects of the attacks wouldn't be so great. So what stem cell transplant or involves is essentially taking someone's bone marrow, which is where all immune cells or white blood cells are created, kind of putting it away for a time, and then trying to, as much as possible, really wipe out the immune system, because you want the body to rebuild an immune system with normal immune cells.
Sort of like a blood transfusion.
Yeah, very much so. And the process of really wiping out the immune system involves some chemotherapies and other treatments, other drugs that reduce the immune function, but almost to nothing.
Wow.
And then you put the stem cells back in, you retransplant them essentially, back into the bloodstream, where they begin to divide and grow. And these stem cells essentially create a new immune system in a person.
How long would something like that take in the body?
Yeah, a long time.
Yeah.
So it takes a long time not only to harvest the immune cells and grow them outside of the body.
Right.
It takes a while for the treatment to kick in to wipe out the person's immune system, and then you have to transplant it back.
That's scary in and of itself, to wipe out an immune system. Your life, you have to be, your life has to be maintained.
Well, it's a very complicated procedure, and it's only being done at very specialized centers where people are monitored very closely. And at this point, we're still several years away from this being a treatment for MS.
Right.
But it's promising to think about it, because you're really trying to change the whole way the immune system functions. If you've got an overactive, abnormal immune system, why not wipe out all those cells and give people back more normal cells that might have normal immune function?
Are these people's own stem cells that you're using?
Yeah, most of the time.
Okay.
Most of the time. And the studies that have been published and that people are working on now are small groups of patients, usually 10 to 20 patients, and they have found that when they do this stem cell transplantation, they can lead to remission, okay? That's a concept in MS where the disease is not active, where people aren't having attacks. And a stem cell transplant, if you will, in someone who has MS is effective, seems to be effective in a small group of patients at controlling the MS or at reducing the number of attacks. And that may be because you've essentially really shut down the immune system for a prolonged period of time.
Almost
that comes
like resetting a computer.
Like
right?
resetting a computer, very much so. And
I'm trying to use layperson's analogies.
That's great. And I think that it's a promising area of research, but it's still a long way away, and there are a lot of side effects and problems that come along when you can imagine when you're doing this sort of a procedure.
Here's my question. Okay, let's say you decide to yank out the immune system, so to speak, and put in a new one, and hopefully everything goes well. Wouldn't you also want to know the reason why the old immune system did what it did? Don't you want to learn? I mean, it's like, painting over, I want to know where the water is coming from. I want to know the source of the problem.
Absolutely. And that's so far the issue with all of the drugs that treat MS. They are variably effective. So some of them are very effective at reducing attacks, and some of them are mildly effective. And for individual patients, you don't know from the beginning who's going to respond to drug A and who's going to respond to drug C. So it's a trial and error process. Absolutely, we want to know about what the core problem is.
Because what if, you don't want it to happen again, the
Sure.
same person?
Or if you could imagine preventing it.
Right.
Trying to prevent MS in somebody who has the genetic background and some of the risk factors for MS, you might say, oh, well, if we could give you this vaccine,
Right.
like we can prevent an infection with vaccines, there are people interested in whether that might help prevent MS. But we're still not at the point where we know what the real cause is.
I got so excited asking my questions, I forgot we need to go to a break. So we will do just that. Dr. Jonathan Cahill, he's a neurologist at the Rhode Island Hospital, and we're talking about MS today. We'll take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest today is Dr. Jonathan Cahill. He is a neurologist at Rhode Island Hospital. We're talking about MS, talking about the National MS Society. We'll get to that too. Talk about Rhode Island Hospital, what they've developed as far as MS and your relationship with the society and all the good stuff.
Sure. So I work at the Rhode Island Hospital Multiple Sclerosis Center. We are a group of neurologists as well as other people who take care of patients with MS, nurses, physical therapists, and we see patients who have MS, and we take care of them from the beginning when they're first diagnosed and they're on all these treatments that we've talked about. Unfortunately, and eventually, MS typically does progress and it gets worse with time. People develop a lot of disability, trouble walking, for example, but many different functions of the brain and spine are affected, and so people can become very disabled from MS as time goes by. And we do our best working with a lot of different professionals to take care of those folks. We're also involved with clinical trials. These are usually large national clinical trials on new drugs or different uses of old drugs to reduce the disability, reduce the attacks of MS.
Do people who have MS and are suffering, are they anxious to try anything new just to see?
You'd imagine, it is a wide range. Obviously, there are some people who say,
I don't want to be the
I don't
guinea
want to be the
pig.
guinea pig.
Yeah.
Leave me out of it. And there are some people who say, I'll try anything because, this disease is continuing to progress, and I've been on, treatment X, Y, and Z, and those treatments haven't helped me, so I'll try anything.
There really is no substitute for a human being, try and see if it works or not, right?
Certainly. And people who participate in clinical trials aren't always benefiting themselves, right? The treatment might not work,
Yeah.
or the treatment might have side effects. They really are doing it for the benefit of future generations, future people who might have MS, 10 and 15 years from now might be able to benefit from the treatments that are being studied now. So I'm always, very impressed, and I know that all of these research organizations are very grateful to individuals who volunteer to participate in research. It's very, very important. And it's very, very expensive.
Yes, it is.
And a lot of the treatment studies for MS, there's multiple different sources of funding, but all these clinical trials cost millions of dollars. The pharmaceutical companies who make the drugs sponsor and pay for a lot of it. Private philanthropic groups like the National Multiple Sclerosis Society sponsor a lot of clinical research, which is great. And our center, the Rhode Island Hospital MS Center, is affiliated with, and we work very closely with the National MS Society regionally. Other groups like the National Institutes of Health, certainly, the U.S. government, are funding a lot of research in MS. It's a very dynamic field. There's a lot of research going on constantly all over the country, not you know, just here in this region, but certainly every place is very interested in trying to find out what are the root causes of MS, how can we alter this disease that seems to progress despite the current treatments. You know, the current treatments, when they first were coming onto the market in the early 1990s, it was great because we finally had something that was proven and shown to
It was a
slow
sign
down
of
the
progress,
disease.
right?
Absolutely. And it's been continued progress since that time.
So if you look at the timeline, do you see things going in the right direction as far as
Absolutely,
progress? Yeah.
absolutely. I've only been, you know, through my training and finished and out in actual practice for less than 4 years now. And in that time, there have been 3 new drugs onto the market. So the drug development is really rapid. It can be confusing for patients and for neurologists, quite honestly, about which treatment is right for this person and which treatment is right for that person. And, you know, if one treatment doesn't work here, it might still work in the other patient. And if it doesn't work, what do you do next? We're always looking for what to do next. Better treatments, treatments with less side effects, treatments that work more effectively.
Is there one thing in the field that you yourself are most enthusiastic about and you think there could be great hope for?
Well, I think there's great hope in where we're heading now, or where the currently available treatments are, is all about immune system function. So it's all about kind of trying to turn down the immune system or change white blood cells so that MS kind of is held in control. Unfortunately, like I said, the treatments don't always work, and the disease does tend to progress. Especially after many years, sometimes people lose nerve cells. They lose neurons even without a lot of inflammation. So you could turn down the immune system as much as you could, but there's no inflammation going on, so those treatments aren't likely to be effective for what we call progressive MS. The frontier of MS research, and probably at some point MS treatment, is going to be drugs or treatments that regrow nerves, that allow the brain to heal itself. Because currently all the treatments are focused on preventing the disease from getting worse and not so much healing the damage that's been done.
Right.
That's really where we don't have anything currently that's ever been proven to help regrow nerves or regenerate lost nerve function.
Is our knowledge of the human genome in the past number of years helpful in this regard?
Possibly to some degree. Unfortunately, there's a lot more to MS than the genetics.
Yeah.
And it's really not understood how, in a small proportion of people who we think the genetics are primarily the reason why they get MS, how that translates to the large majority of people with MS. For example, most people with MS have no family members with MS. There are definitely families where it seems to be more common, but most people that I might see in the office, they don't have any family members with MS, and it's not really a genetic condition.
Right, so then you can't use that as a way to sort of trace its history a little bit, right?
I think for the most part that's true, outside of very small
Yeah.
groups of people or small families where that might be the case. And like I said, it affects all genetic groups. So even if you could identify a specific gene in this group, it might not apply to everybody else.
Do you think there's enough of the word getting out about MS? Like there are other diseases that get a lot of play in the media and just in pop culture in general. Do you think MS is up there?
Well, I think that everyone's heard of MS. I think that it is a common enough disease. Many people know someone who might have MS.
Plus famous people, if they have it, then they can lend their notoriety to getting the word out.
Absolutely. It is still considered a rare disease, and it is still a rare disease. But yeah, I think that organizations like the National MS Society, that's one of their main goals, is to promote awareness about MS. They use the month of March, and everything gets lit up in orange, and people wear orange clothes.
Like what they do with breast cancer with pink. And,
Exactly.
You know what I mean? So
Exactly.
this is a good idea just to raise awareness.
Yeah.
And funding is always an important issue. It's just a fact of life, too,
Absolutely.
right? Yeah.
Fundraising is a huge portion of these groups that are trying to promote awareness, trying to raise funds to sponsor research and to really help people with MS. I mean, the National MS Society does more than fund research.
Right.
They actually provide services and programming and resources for people with MS.
Who don't know what the first step is or where to go or help maybe with peer groups or just support groups and just all kinds of great things.
All of that stuff.
they're-
All of that stuff they do.
that they're involved with. So you have hope for the future, right?
Absolutely.
All right.
Absolutely.
Well, we learned a lot today, and and we have keeping our fingers crossed on great progress being made in your field. Dr. Jonathan Cahill, who's a neurologist at the Rhode Island Hospital in the field of MS research, and we hope to have you on again and talk more. Maybe you'll come on with a cure next time.
All right. Thanks very much.
Fantastic. That is our show for today. You can see this show and many others on our YouTube site. Till next time, I'm Sean Murphy. This is For the Record. Take care.